Hello, everyone. Welcome to the webinar on World Malaria Day. My name is Imanshu, and I'm honored to be part of the webinar titled Can Strategic Implementation Help in Eradicating Malaria on World Malaria Day? Before we dive into our discussion, I would like to take a moment to introduce you to my employer, Texai Research. TechSci Research is a leading global market research and consulting firm with offices in United States, United Kingdom, and India that offer multiple research reports in number of areas to organizations. Healthcare, chemical, agriculture, automotive are some of the key verticals in which they offer reports. Today, So, as we today we gather to raise awareness about the impact of malaria and the efforts being made to combat the disease. Malaria is a preventable disease and treatable disease that continues to have a devastating impact on the health and livelihood of people around the world. As per World Health Organization in 2021, there were an estimated 247 million new cases of malaria and 619,000 malaria-related deaths in 85 countries worldwide. In India, malaria is a major public health problem with an estimated 160,000 cases reported in 2021 alone. This situation is particularly alarming in high burden states such as Odisha, Chhattisgarh, Jharkhand, which account for more than half of the all malaria cases in the country. Despite the progress that has been made in the recent years, malaria remains a serious global health issue that requires urgent and concerted action. The theme of the World Malaria Day 2023 is Time to Deliver Zero Malaria, Invest, Innovate, and Implement. This theme highlights the need for new approaches and technology to combat malaria and improve the lives of those who are affected by this disease. In today's scenario, the government has launched several initiatives to combat malaria, including the National Framework for Malaria Elimination and the National Strategic Plan for Malaria Elimination. These initiatives aim to reduce the burden of malaria in India and achieve the goal of malaria elimination by 2030. Looking to the future, there is reason for optimism in the fight against malaria, but the fight is still to end the malaria, and in the similar lines, several drugs and the malaria vaccine has been developed. Today, we have with us a panel of experts who will shed light on malaria, different approaches to combat the disease, and much more. Our speakers will share their experiences and their role towards the eradication of malaria from the country. Before we begin, I would like to remind you that we have a question and answer session at the end of the webinar. If you have any questions, please submit them using the chat feature and we'll try to answer as many as possible. Our first guest needs no introduction. It is an honor for TechSci Research to introduce to you the recipient of Padma Shri 2021, WHO Public Health Champion Award in 2017, Mother Teresa Memorial Award in 2016, and many more such awards. Dr. Pandav is presently member of the National Council on Indian Nutrition Challenges under Poshan Abhiyan. He is co-editor of 14 books on health science and has authored over 600 research papers published in various national and international journals. Ladies and gentlemen, he is Dr. Chandrakant Shambhaji Panda, famously known as the Iodine Man of India. We are honored to have you, sir. Over to you, sir.
Namaste, namaskar, namaskar. Actually, 25th of April is an important day in the history of mankind, not only in India. This is the World Malaria Day that's being celebrated. The celebration started in 2001 in Africa, and in 2007 it became global. Malaria is an important public health problem. There are very interesting stories about malaria. When you look at the word malaria, it's written mal air. Mal air is malaria. Now, very important thing to understand about malaria is that if you wish to control malaria, you must learn to think like a mosquito. This was written in by a book on health, culture, and community by Benjamin Paul. He wrote this book after understanding the side effects of having Panama Canal. When Panama Canal was connecting the Atlantic and the Pacific Ocean, there were very severe deaths due to malaria. That's the time he mentioned this particular phrase. If you wish to control malaria, you must learn to think like a mosquito. I must also share with you that today World Health Organization celebrates 11 days. Recently we had 7th of April, the World Health Day, but there are 10 more. There is the World Health Day on 7th April, there is the World Blood Donor Day on 14th of March, there is the World Immunization Week 24th to 30th of April, World Antimicrobial Awareness Week 27th of January, World Patient Safety Day 17th of September, World TB Day 24th of March, World Chagas Disease Day 14th April, World Tobacco Day May 31st, World Hepatitis Day 20th of July, World AIDS Day 1st December, and World Malaria Day, which is 25th April. The reason for celebrating Day 11 so far we have is to raise the awareness. Actually, this awareness is a continuous process. In Iringa, which is in Tanzania, two of my esteemed friends, Olivia Yambi and her husband, started the AAA project, Assessment, Analysis and Action. To this, I would like to add awareness. The single most important intervention in any program for that matter, including health, is awareness. That's the starting point. So when you celebrate days like this, you rise the tide of awareness of the population. As Himanshu mentioned, this time the focus is on time to deliver zero malaria, invest, innovate, and implement. The first two are relatively simple, but the real challenge in implementation is implementation. And I want to tell you a story about implementation. This is a story of a centipede and a wise owl. Centipede, poor fellow, had arthritis in all his 100 legs. You can imagine his quality of life. He went everywhere, including the All India Institute of Medical Sciences, New Delhi, where I spent 45 years, which is, I'm very proud to say, gives high quality care at affordable cost. But still his arthritis did not disappear. Then some of the neighbors asked him, then why did you go to the wise old and ask him how to get rid of this arthritis which is affecting 100 legs? So the centipede gathered courage and went to the jungle and met the wise owl. Wise owl had remedy for all kinds of situations, not only health but other issues as well. So wise owl said, it's very simple. Why do you have to come so far to meet me? Today we have technology. You could, you could come on online and ask me about it. But he said, I was very keen to meet you in person. He says, very simple, Mr. Centipede. You have 100 legs. What you need to do is become a man. So with 2 legs, your pain will be bearable. The centipede was so excited, he thanked the wise owl. But wise owl had a condition. He would ask only one question, only once. So he went to the home, and his wife was very happy to see him with a smiling face for a change. Then he told that the wise owl had said, I must become a man. Like all wives, she was a very pragmatic lady. She said, you are a centipede, how can you become a man? Oh, I forgot to ask this question to the wise owl. So next day he went again. And he pleaded, oh wise owl, I know your condition that we can ask only one question, but please make me an exception. He said, what is it? He said, I'm a centipede. How do I become a man? The wise owl looked sternly at his face and in his eyes. He said, listen, young man, I only take policy decisions. It's up to you to implement them. So that's the challenge of implementation. Major challenge. If you have to do implementation, you have to step beyond the technical and medical boundaries. You have to understand 6 disciplines. psychology, sociology, political science, economics, anthropology, and philosophy. Unless you study these disciplines, you won't understand what the people's perceptions, knowledge, attitude, and behavior, which are essential to change the behavior of people. And these are never taught in any medical school curriculum. I was a member secretary of a committee in 2006, National Rural Health Mission. I had made my presentation, Dr. Javed Chaudhary was the chairman. So I had written in that particular report, please introduce these six disciplines. That report is gathering dust in the ministry. So that's where we stand today. Easy to say implementation, but very, very difficult, challenging. So that's my preliminary comments on malaria and the story in general. Today, when we discuss any health issue, we talk in the context of 17 social development goals. Goal number 3 is health and well-being. Health and well-being or wellness. So I'll wait for I'd love to interact with the audience. They're the most important people. I would like to engage into question answer sessions rather than give a monologue, especially after the graveyard session. Post lunch session is always a graveyard session. So thank you so much, Himanshu. These are my initial comments. But as the story moves forward, I would like to have more interactive session. Shukriya, Dhanyavad. Himanshu, I'd like to have an interactive session later on. Kaushik is sitting next to me on my right hand side. So thank you so much, Himanshu.
Again, moving on to the next speaker for the event, which is Dr. Kaushik Sarkar. Dr. Sarkar is the director of the Institute for Health Modeling and Climate Solutions and is committed to assisting nations in addressing the increasing menace of infectious diseases in the area of climate change. He is the former country head of Malaria No More, with a career spanning over a decade and a half. Dr. Sarkar's exemplary leadership and indelible contributions to global health have earned him a plethora of accolades, including the esteemed Healthcare 40 Under 40 and Outstanding Leadership Award. His work has been garnered in over 1,000 national and international media and journal citations, reflecting the profound impact of his endeavors in the field. Welcome, sir.
Thank you, Himanshu. I'll also have a quick introductory note and then would engage in any more interactive session. I'll start right from where Dr. Pandav left. And this is an incredible example or analogy related to the policy and implementation gap that exists globally, especially when it comes to managing the most pressing challenges of health securities. And malaria is one of the oldest diseases. In fact, when I was in my medical school, I was used to be told by my faculties that if you learn malaria, you know epidemiology because it actually has all the three elements within it, the host, the environment, the vector. So practically you are getting everything alongside the infectious agent. Now, the problem of malaria elimination is not only one prompt. So, for example, implementation prompt, there are myriads of challenges that include, or rather that start from the priority of the disease within the health agenda itself, the resources that are allocated for malaria elimination. We continue to see huge resource gaps or huge funding gaps that still exist and needs to be bridged in the World Malaria Reports year on year. We also see that the global malaria situation has reached a crossroads from where we are not seeing much progress in terms of the reduction in the burden of diseases which is another piece of challenge, although we see more and more countries announcing malaria free status or malaria eliminated status, but that also means that the approach should be much more intensified, much more focused to those areas where cases are not responding to the current strategies and the implementation mechanisms. And finally, last but not the least, as I said, that malaria is very often not a priority within the health agenda. It is also not considered a priority in majority of the countries when it comes to the frontline healthcare work. Because for the health workforce, there are too many things to deal with, starting from maternal and child health issues, respiratory health problems, geriatric health problems, oral health problems, non-communicable diseases, and infectious diseases like tuberculosis, HIV, diarrheal diseases, and so on. There are myriads of problems that countries deal with, the healthcare system at the front line deal with. And especially when you don't see a huge burden of diseases, when fatality of a disease has also gone down, a lot of deaths are not occurring due to a particular disease. The focus from elimination gets lost. So elimination is always a costly battle. The price, the return that we get is always a long vision piece of agenda that need to be considered. And finally, we also need to be mindful of the threat that climate change brings. One of the biggest issue that we are seeing these days is that malaria and the agent itself and the vector, they are entering new geographies. In fact, I think a couple of days back, I was having a discussion with one of our partners regarding the entry of Stephensi in several African zones. Similarly, naive zones like the Himalayan region, they are becoming more and more vulnerable with global warming. And because of these challenges, what we are facing right now is that those communities who are actually naive to these types of illnesses, they may face increased risk of malaria in the coming months or years. So with that, we have to be preparing for a resilient approach as well. That will be kind of a little futuristic, but at the same time be mindful of the implementation and policy gap that Dr. Pandit started with. And I'd love to answer questions or interact on agenda items or discussion points that the audience may have. But thank you so much for joining, and I look forward to having more intensive discussions on the issues that we have raised and discuss certain solutions that can be a game changer for this battle against malaria in the coming years. Thank you.
So, like we said in the beginning, that we have received multiple questions related to malaria and increasing prevalence of malaria. Let's go through the questions first. What is the global burden of malaria and how has it changed over time, sir?
The global burden, as I mentioned earlier, in fact, you also mentioned it, in the year 2021, the deaths were over 600,000. And the number of new cases of malaria were close to 250 million. Over a period of time, as Dr. Kaushik Sarkar mentioned, more and more areas are getting exposed to malaria as a result of the massive deforestation and migration that is taking place.
Okay. And the next question that we have for you, sir, is what are the most effective strategies for preventing and treating malaria?
Dr. Sarkar, would you like to take this?
Yeah, sure. So the most effective strategies are the oldest and the simplest ones. Those are the proven strategies like early diagnosis and complete treatment. As we speak today, malaria or rather fever care seeking needs to be highlighted, because patient doesn't come to a health facility with malaria. The patient comes with the cardinal symptom as fever. While febrile malaria is a major problem, afebrile malaria, which is a major precursor to malnutrition in the kids, is also another huge issue. So, from this perspective, early detection and complete treatment is essential for malaria, and treatment completion essentially is critical, especially for vivax malaria, because falciparum malaria, the treatment is for 3 days, which is simple follow-up for 3 days. But when it extends to 14 days, and especially because after 3 days you are not having fever because you have already taken the medicine, but you will have a relapse if you don't take the 14-day course of the medicine. So essentially, treatment completion is critical, and this is one such area I always emphasize, because when I was in my medical college hostel, I was affected by vivax malaria 3 times in a single year. And the reason is that for the first occasion, I never took primaquine. For the second occasion, I took primaquine, but for some days. And finally, on the third occasion, I completed the course of primaquine. And Vivax is, I would say, very, very difficult to eliminate, and also difficult to treat. It would relapse. So treatment completion is critical. Critical for both, but of course, more for Vivax. The second approach I would say is surveillance. Surveillance is not only the pillar for malaria elimination, it is the main framework, a main pivot on which the other intervention strategies are sitting. If we don't have surveillance, we can't take decisions on the interventions. So precise surveillance, finding out geographies where the active malaria foci exist, and also where the foci are getting inactivated, but then there is higher risk of reactivation. So monitoring those areas, this is critical. And the more granular surveillance should be, it's better for the entire program. And in fact, I'll congratulate the Indian government for their recent focus, on a more granular micro-level programming from the aspirational district to aspirational block program, which takes you to the sub-district level focus. And that's an outstanding approach that the government has taken through their result-based governance, which I believe would change the game for not only malaria, but for other battles as well. The third is connected to surveillance is, of course, outbreak preparedness and response, and without response, surveillance is meaningless. The third is integrated vector management. As Sir was saying, if we have to deal with malaria, we have to have the mindset of the mosquito. So right now, majority of the countries and national malaria control programs are really looking into the adulticide measures, that means mosquito killing measures. But one important environment-friendly, ecologically viable alternative, or rather complementary initiative or measure, is larval source management and larviciding, which is often neglected in malaria control programs worldwide. And in fact, innovations are also too few in case of larviciding. So this is one area where drone technologies and biolarviciding, these are gaining currency. This is a low-cost approach. There is an opportunity of community participation and engagement in larviciding, and this can actually leverage several of India's missions. For example, Swachh Bharat Abhiyan, and then you have the Digital India mission, where and the technology endeavors. For example, you can use drones to monitor. In fact, last year I saw one such approach that is being taken in the city of Mumbai or in Maharashtra, where drones are being used to find out these larval breeding sources. At the same time, there are newer traps, automated traps that are there that can monitor entomological, so the mosquito data. So this is very critical that we monitor the entomological or mosquito related data. We monitor what their changes are, how they are behaving. We should monitor what their resistance patterns are to different insecticides, because definitely insecticide resistance is a global issue and it's increasing. So you need proper insecticide resistance management strategies. And at the same time, these new tools and technologies that can avert the risk of higher mosquito density and greater malaria burden, or even malaria outbreaks, especially during the season in the year in highly vulnerable areas. And finally, I think sir started with awareness part. So there are 4 or 5 cross-cutting areas, starting with community awareness, where you not only need this mass awareness initiative, which is kind of thanks to TechSci research we are organizing today, but also there needs to be interpersonal communications, which is happening through ashas in India at the village level. But this can also be through smartphones or social media and other digital platforms, and we must leverage that. In fact, at Malaria No More, we ran a massive digital campaign, awareness campaign in 2021 and 2020, and in that we could reach in no time more than 300 million people and got a massive impact. So for mass awareness, we need to leverage again these technologies, the 5G network, connectivity and all. And again, for the interpersonal communication, we need to strengthen the hands of our frontline healthcare workers who can educate our mothers and families and households. And of course, another insight from our campaign was we used a character, Dadi, grandmother in India, for telling the message in 2021. And we found that this is incredibly helpful. The uptake, the engagement was much higher when it comes from a wiser lady. So wiser mind or face telling some messages to the community or propagating these messages, that is very critical. So you have to think of these small innovations as well when you propagate messages to the communities. Involvement of media is critical, because media is kind of the voice of the public to the policy as well as the politics. So the higher priority you provide to this, the higher priority it gets within the overall social and national development agenda. Research is critical, especially malaria vaccine research. It's progressing very quickly. Newer platforms are there. In fact, India is contributing a lot in malaria vaccine research. But then there are, of course, challenges. And for those challenges, we have got only one vaccine which have been rolled out at scale so far, and another vaccine on the verge of being rolled out at mass scale. But more effective multi-stage vaccines are being tested and tried. And countries like India can also explore the opportunities of where these vaccines, in which population they can be applied, in which modes, in whichever strategies or campaign modality or approaches. And finally, monitoring and evaluation. No implementation program can succeed without stringent monitoring and the commitment of the frontline workforce, their capacity building, their continuous refresher courses, and making them aware. So if I think once our Honorable Prime Minister said in Man Ki Baat that if the Ashas of India takes them in vow that we will eliminate malaria from India, India will be malaria free. And I think it will be malaria free, even it can eliminate malaria even before 2030 if the Ashas, 1 million Ashas that we have, they took a collective vow to eliminate malaria. Sir, anything to add?
I just want to add a few points to an excellent answers by Dr. Kaushik Sarkar. Point number one, reaching 300 million people in today's technology is an amazing thing. Today, India's population is 1,200 million. So reaching 25% of India's population, which you could never think of in the past. So technology for the use of people, that's very important. That's number one. Number two, You mentioned about your own personal story of what happened when you were a medical student. I have been working in northeastern Bihar and UP since 1980. Now, very interesting thing happened there. Though everybody, the medical officer gave the protocol, but there was a supply chain issue. So, in August, he would give the complete treatment. In December, he would give half the treatment. In March, he would give one third the treatment until the next supply came. So, this is an important issue that needs to be addressed, and there is a regular chain of supply of the drugs that are available. Number three, about monitoring and evaluation. What I would add, Dr. Kaushik Sarkar, is external independent monitoring and evaluation. That's very vital, third party evaluation. Number four, I wanted to say is that the real answer to malaria, as I said, we must learn to think like a mosquito. Ultimately, what happens? There is a breeding place for the mosquito. So it's a man-made disaster. And public works department is an important thing. When they are making the roads, they are digging out the earth, that becomes a place where water is stagnated, and that's how the malaria start breeding. So these are the some issues. It looks very simple, but when it comes to implementation, you face the real life challenges. So we all must be together. And finally, he made a very important comment that आशा अगर हमको जिंदगी में स्वास्थ्य की आशा चाहिए तो आशा का महत्वपूर्ण रोल है. They have a very important role. It is through them ultimately there will be Jan Andolan. उसके बिना हम आगे नहीं बढ़ेंगे. We have seen that in smallpox. We have seen that in polio. Unless there is Jan Andolan to health in particular, we will not make any change in terms of not only malaria but other diseases as well. The next point he made was about the changing priorities. Today, 75% of the deaths are caused by non-communicable diseases, 75%. So there is a shifting interest. As I mentioned, as time passes, this program is going on since late 1950s. So there is a waning interest in this, and the focus is more on NCDs. So that also needs to be taken into consideration when you look at malaria situation. Finally, there is ATM, not automatic Taylor machine, but AIDS, tuberculosis, and malaria. That needs to be brought into action again and again. That's why celebration of these days is very important. Take stock of the situation, look at what needs to be done, look what is the learning in the past, look which are best stories, and then take it forward. And we must also, like Dr. Kaushik Sarkar said, admire tech science of bringing these issues using our own medium and strategy for spreading the message to the population. Thank you.
Okay. Moving on to next question, sir. Isn't there a malaria vaccine? As per the records, malaria vaccine took 20 to 30 years to develop. Why did it take so much of long time for the development of a vaccine? And if there are, how is the process regarding the distribution of the same?
I again request Dr. Kaushik Sarkar, he is more familiar with that. I'm more familiar with the public health aspects of our situation. Dr. Sarkar, over to you, sir.
Thank you, sir. So, Himanshu, for the interest of our audience, I expect the audience would be pretty diverse and not everyone would be from a very technical background. To say it simply, there are so many different targets that need to be addressed, and the issues of adjuvant. Adjuvant is something which you use alongside vaccine to, the actual vaccine that you are developing, that is being developed on top of an adjuvant, which is required to put it in. And both of these challenges existed within the malaria vaccine development. The current malaria vaccine that was, I think, rolled out in multiple African countries, and we saw the reports of the efficacies out there where this vaccine works well. One of the biggest challenges is that globally, not every malaria is not the same everywhere. For example, in India, you will find a lot of buybacks, but also falciparum cases in central parts of India like Jharkhand, Chhattisgarh, MP, parts of UP, northeastern states, and others. In Africa, it is predominantly Plasmodium falciparum, but you will also find Malaria, oval, and others. At the same time, in other countries like Indonesia, you will find buybacks again in majority of the places. But then the highest endemic areas like Papua, West Papua, they have these burden of falciparum, which kind of gets transported when there is more, maritime connections and migrations of the communities and so on. Now, that's why, because there are different types of malaria and the vaccine kind of target one species right now, it's difficult to prioritize that vaccine for all of the geographies. The third piece is the vaccine is applicable for one particular age group, the younger age group, whereas a lot of malaria burden, if we look into it from India's perspective, a lot of burden is coming from the adults themselves. And these population need complete other measures for protection. Apart from that, scientific challenges or R&D challenges also exist, like human challenge models. Don't find many. In this country also there is there are challenges in terms of the challenge model itself. So there are not only developmental issues or R&D issues, there are also issues related to rollout. As we were talking about the priorities, just told NCT is increasing, and in the overall vaccine agenda, it was a problem. In fact, Gavi and others who are leading these vaccine finances and the rollouts globally, they have now started, considering even malaria vaccines and supporting these rollouts. So it's not just an R&D problem. Your supply chain, the global financing, the supply side needs to find out approaches to roll it out. The national governments and the global organizations, the UN entities need to sit together to create a global vaccine rollout strategy based on the technical nitty-gritty. So technical expert groups need to be formed for that. And at this same time, we also need to consider that what operational challenges these countries will have, what absorption capacities these countries will have, and how different technologies can be used not only to meet the operational challenges, but also the larger challenge of R&D that also exists. So with that, I refer back to Sir, if Sir you have any additional comments too.
Yeah, I just want to emphasize again that Dr. Sarkar, you raised a very important point. There are aspirational districts and aspirational blocks. I think we need to focus. The theme also this year says a theme. It's important to take care of the population that is marginalized and use the existing technology and strategy to address this. This is a very important point you raised about aspirational districts and aspirational blocks. बापूजी यही कहते थे ultimately ग्राम स्वराज्य की बात है. It has to go to the villages that require the most attention, and that happens basically in tribal areas of three states you mentioned: Orissa, Jharkhand, and Bihar. So that's
Sorry, sir, for cutting you off right now. Basically, Dr. A.P. Dash has joined us.
Oh, very nice. Dr.
Namaskar,
Das,
sir.
Namaskar, Dr. Das, Namaskar.
Namaskar, sir.
नमस्कार नमस्कार.
Okay, great, sir. So another guest for the event is Dr. A.P. Dash. He's the nationally celebrated speaker. Mr. Dash has devoted his career in developing various tools, technologies, and strategies in biomedical science. His notable contributions include establishing Anopheles annularis as an important vector in the rural areas, and identification of telomerase activity and gematocytes of Plasmodium falciparum. He was instrumental in proving the efficacy of mass drug administration, which was later included in the LF elimination strategic program by the World Health Organization. He was also a part of research that sought answers to the questions on the molecular taxonomy of Indian mosquito vectors. Dr. Dash has over 11 years of experience as director of different research institutes under Indian Council of Medical Research (ICMR) and Development of Biotechnology under Government of India. He is the Vice Chancellor of Asian Institute of Public Health and served as the Distinguished Scientist Chair of Indian Council of Medical Research and Regional Advisor of Vector-Borne and Neglected Tropical Diseases at the Southeast Asian Regional Office at World Health Organization in the past. Dr. Dash is also the recipient of the Padma Shri 2022 for his distinguished services in the field of science and engineering. Welcome, sir.
Yeah, thank you very much. At the outset, let me express my gratitude to Dr. Pandab and to your organization for giving me this opportunity to come over here to this platform and interact with you for a little while. I'm extremely sorry that I could not, though I am in Delhi, I am not able to present because of a important personal work for which I was stuck up in Faridabad port for a very long time. So about today is World Malaria Day. We have been celebrating it. We have been celebrating the World Malaria Day while I was in WHO in a big way. For now, I'm very happy that your organization is observing the World Malaria Day. Now, this is a time where the malaria is targeted for elimination by 2030, and India is determined to reach the level of elimination by end of 2027. Our knowledge on malaria dates back to 1800s when the malaria parasite was discovered by Lavaran on 5th November 1880, and the transmission biology of malaria was understood in 1997, and Sir Ronald Ross got the Nobel Prize for his work in Hyderabad. In fact, is the first Indian to get Nobel Prize in from India, because by birth he was an Indian. He was born in Almora district. Since then, lot of work has been done. Now at that time, the Malaria Research Institute, now called as NCDC, did a lot of work on malaria in India in those days. Now I do not want to go into the details. As we know, many people say, because you are in the elimination era now, we must talk about elimination. We must think of elimination, and you must do whatever you want to do or say, regarding aiming at eliminating malaria. As all of you know, most of the diseases are targeted for elimination by 2030 to achieve the Sustainable Development Goals by 2030. We people say, I know many big people say, and we had an interaction with the Nobel laureates in Ahmedabad, I think 5 years back. Even Nobel laureates were saying India should learn from Sri Lanka because Sri Lanka could eliminate malaria, but India has not done it now. But people should understand the transmission biology of this disease. If you take Sri Lanka, there is only one vector system for malaria. Mainly Anopheles species is responsible for most of the malaria cases. But when you come to India, there are 10 vector systems responsible for transmission of malaria, and within the vector system, there are sibling species who differ in their best biting behavior, in their resting behavior, in their feeding behavior, and also ultimately resulting in the transmission pattern. So therefore, malaria in India is quite complicated. It's not like Africa. Like Africa also has two vector systems. We have 10 vector systems. That is important. Rightly, the present target is use of long-lasting insecticidal nets and vector control and early detection and prompt treatment, as we have been doing earlier. Prompt, I say early detection and complete treatment by the appropriate drugs. Now, no more poor drugs for poor people. We must give any appropriate drug for everybody. So at this, when we say there is an example, there are two examples of malaria elimination. We can see the Mandla Malaria Demonstration Project, which was undertaken by the National Institute of Research on Tribal Health in Mandla district. How, using the present strategies, malaria reached the zero level. Then we can see in Orissa the Daman program, Durgam Anchalare Malaria Nirakarana. That is Daman program. Basing on Daman program, what has happened in Orissa, let me tell you the story that in way back in 2008, the chief of WHO of Southeast Asia region visited Orissa. He met the chief minister, he met the chief secretary, he met the health minister, he made the health secretary, everybody was talking, please help us to control malaria. There was a brainstorming meeting which recommended some strategies, the use of escalating the use of LLAN, distribution of LLAN, IRS in the certain areas, and all these things was recommended. The recommendation implemented on a program called Daman. It was damn successful. It was very successful. Malaria cases came back drastically. Now there is a movie on Daman, an Oriya movie, which has been translated in Hindi, and people should see that how Daman program was implemented there. So saying that now let us see that we take the endemicity as API 2 and above. There are 19 districts today in India which are above API 2, and there are 100 some districts which are below API 2, and below API 1 there are many districts. So we have to reach below API 1, not only below API 1, we have to reach the zero level. Therefore, recently the roadmap for malaria elimination in India was developed by the government of India. It is almost finalized. We have to follow the roadmap, and their targets are given. By this year, this many districts will come under elimination. By this year, this many districts. So, bringing malaria to zero level by December 2027. I think all of us know how malaria is caused. All of us know how malaria can be prevented. All of us know how a complicated malaria case can be treated or managed. So, what is required? We do not need a seizure to cut the DNA to control malaria. What is required is appropriate efforts from all the sectors to combat this disease. Malaria is not only the department's program. Malaria is everybody's concern, and everybody should contribute to malaria. So I think with this idea, will do the risk study. National Vector-borne Disease Control Program in India is an umbrella program which is doing a great job in bringing down malaria. I think all of us should support it technically and non technically to achieve zero malaria cases by December 2027. Thank you very much.
Thank you, sir, so much.
Thank you.
Sir, we have Thank you, sir. We have received some question for you also, sir. What improvements can be
Yeah.
seen in rapid diagnostic tests for malaria in the coming
What,
years?
sorry, what appropriate?
What improvements can be
What?
seen in rapid diagnostic tests for
Yes,
malaria
yes.
in the coming years?
See, for diagnosis, microscopic diagnosis is the gold method, gold standard. But we have many additive rapid development rapid kits which can do it. But we should have a good kit for plasminovirus. To get a good kit, diagnostic kit for plasminovirus is very important.
Okay, sir. Moving on to Dr. Chandrakant, sir, we have a question for you. What is the best drug to take to prevent malaria while traveling to a malaria endemic area?
Actually, they continue to advise on chloroquine. So chloroquine is the best drug. That's my understanding. Unless Kaushik, you want to add anything to that?
Yeah, so I would just say that there is a global guideline for different countries. I think by CDC that clearly says if you are visiting a particular country, whether you need any anti-malarial drug for your visit, and then for that country, which particular drug. There are several drugs, but anti-malarial drugs have their adverse effects. So, based on the risk and the benefit that the person may have, those drugs have been proposed. But as Sir has said, that the main regimen for the travelers have been chloroquine, and in sometimes mefloquine as well. For India, we do not suggest any presumptive treatment of malaria. In fact, presumptive treatment is banned in India for several years now. And because it's a malaria endemic country, it's not about that you are visiting somewhere. We recommend in India that if you are visiting a very high malaria endemic space or state, you can use actually personal preventive measures. You have these repellent creams these days, or repellent that you can apply, full sleeve clothing. So these type of protective measures are recommended by the Indian government. And that's the same thing I would also recommend here for the Indian communities. For the globe, I think the CDC guideline is sufficient.
Okay, sir. Moving on to Dr. AP Dash. Sir, how can partnerships between public and private sector organizations facilitate the development and implementation of effective malaria diagnostics?
Yeah, there is a great need of public-private partnership, because who will develop the diagnostic kits? Maybe research institutes and the industries and the private organizations. That is why I said the research institutes should tie themselves with industries to get better results. This is the problem in India. See, in India, if you consider science, this is what this lecture I give everywhere. We lack in patent culture. We do not have a good patent culture in India. If we want to prosper in India, we need to have a very good patent culture. How to improve the patent culture in India? There should be public-private partnership to develop the patent culture in a bigger way. So public-private partnership can develop the diagnosis is very important, so that the government research institution can provide the inputs from their side. The private partners, they can develop the diagnostics in the proper way.
Okay, sir.
So
And
public-private partnership not only in diagnostics, public-private partnership not only diagnostics, it is essential for malaria elimination in everything, even in long-lasting nets, in vector control, in treatment practices, everything, everywhere it is required.
Dr. Chandrakant is also saying something, sir. Yes,
Himanshu,
sir.
Yes,
I just want to say, somehow the Indian environment is very shy to public-private partnership. But when you look at the United States, it's embedded into the thing. The private institutions, the academic institutions, and the governments come together to address a given problem. That is missing in the Indian culture. Even for the Indian story, no government makes side sword. Without private partnership, we could not have eliminated IDD. So I very strongly support about public-private partnership and the patent culture, which Dr. Tash has emphasized again. I very strongly support that.
Himanshu, I'd like to add a point.
yes, yes, I agree. I agree with Dr. Pandab. Yes. Hello.
Himanshu, yeah,
Yes.
Himanshu, I
I
would
think
just add one P to that.
Yes, sir.
So I would like to add the pupil also. So we should say, public, private, and pupils partnership, because if the community does not participate or does not own the agenda, I will give you a very small example. There are several housing societies in the urban areas. If these people, if the housing societies take an initiative, we can combat the larval sources a lot. We not only address the problem of vivax, we also address the problem of dengue at the same time with their participation. And I think I would also say that a lot of so public and private, a lot of elements are from the supply side. So as we talk about products and interventions, the people by the government and the private sector are partners of the industry itself. But when it comes to their use, if the community is not using a particular product, so for example, let's say we bring the government of India along in coordination or in partnership with any particular organization or donor, bring the best long-lasting insecticidal net in India. But the community member who was at the greatest risk of malaria, maybe at one corner of the state Odisha, is not willing to use that. So then that delivery or that entire effort would be futile. So that is the reason that you actually need public, private, and pupils partnerships. So PPP models and social awareness campaigns. So this should become hand in hand in the programming initiatives that we undertake.
Absolutely correct, sir. Sir, AP Dash, sir, we have a question for you that so when it comes to malaria diagnostics and the treatment, how can one measure the impact of malaria therapeutics on patient outcome and on public health? Sir. Okay. I think Dr. AP Dash is facing some issues related to connectivity. Sir, how can we measure the impact of malaria therapeutics on patient outcome and on malaria on public health? And are there any latest advancements
Yes,
related to?
I could not hear you because I'm traveling and it's getting disconnected in between. See, you
Oh,
asked me something about malaria diagnostics.
yes.
Let me emphasize that we need a good diagnostics for Plasmodium vivax. As you know, in India, Plasmodium vivax is a problem. It's going to create problem for malaria elimination because of several reasons. We need a good diagnostics. The biology of Plasmodium vivax is entirely different because of the hypnozoites. We need to control the hypnozoites. You need a good drug to control the hypnozoites. So Vivax, we should emphasize on Vivax research much more. We know everything about Plasmodium falciparum because the entire world is working on Plasmodium falciparum. Anybody who wants to do research on Vivax, they have to come to Indonesia or India. These are the two places because we have the problem of Vivax. So Vivax, I will again re-emphasize there is a need to develop good diagnostics on Vivax, not only good diagnostics, even we are not able to culture Plasmodium vivax as we culture Plasmodium falciparum in the laboratory.
Yes, sir. Another question is, what developments can we expect from the pharmaceutical companies that can aid in eliminating or completely removing
See,
malaria from the life?
there are two immediate things for the pharmaceutical companies. One is diagnostics, the another is anti-hypnotic drugs.
Okay, sir.
There are some
And
drugs available, but we still need better drugs and better diagnostics.
Dr. Das, if I may intervene, there's also a question of price that comes into picture.
Yes, yes,
How,
yes, yes.
how does one handle that issue?
okay,
Right, yes,
sir.
yes.
So there is recent news of Zydus developing a single pill for the treatment and improving the overall treatment scenario of malaria. What would you have to say about the same?
Which one? I could not hear it
So
properly.
Zydus is developing a medicine which is a single pill medicine for the treatment of malaria. So what would
That
you
will be
like to
great.
say about that?
That will be great. If we really have one scientifically prove it with good clinical trials, that will be great.
Hmm. Okay, sir. Another thing that we have for you, particularly why Plasmodium falciparum based cases are high in India when compared to other Plasmodium parasites in the country. What would you like to say, sir? Dr. Chandrakant, sir.
Actually, falciparum is very important for causing mortality. I have to share with you a very sad story that in the late 1980s, one of my old friends, they're making a film on anemia and they're gone to the Africa for that making that film. And one of my very dear friends, he got affected by malaria, and that happened to be falciparum, and he died because of that. So that's a very sad story. Falciparum is notorious, in fact, malicious for causing deaths. So that needs to be taken into consideration. While that is happening, as Dr. Dash and Dr. Sarkar, both of them have mentioned, a real battle in India is PYMX.
Okay, sir. As Indians, they resort to all sorts of home remedies for the treatment of diseases. So, are there any approved drugs for malaria by the FDA? And are there any home remedies for the same?
At least I'm not aware about the home remedies for malaria. I'm not aware. But
Okay.
maybe you're raising an important point. We could ask the other disciplines, Ayurveda, homeopathy, Unani systems, if they have any treatments for addressing malaria. We need to. You brought a very important point of integrative health that needs to be addressed. So that's a very important learning for us as far as I'm concerned, Dr. Sarkar, Dr. Dash in today's schedule, today's program.
I agree with sir. So, um, if we so India still follows the 2014 National Drug Policy or the guideline for malaria diagnosis and treatment. and within that guideline, we do not have any provision for home remedies for malaria diagnosis and treatment. In fact, we always say that within 24 hours of fever, you should get tested for malaria, and as soon as you have got tested and you have your result in hand, you should be treated with the appropriate anti-malarial drug based on the test result. And not include any other disciplines remedies that might be there. We know the focus and the Indian government's priorities on the other disciplines of medicines and integrative healthcare, which can definitely be explored. More research would be needed on those areas. But from the home side, I believe personal protection. I think I emphasized that a couple of times earlier, but this time I'm repeating this, that there is no alternative to personal protection and a community action. So as long as you take appropriate personal protection, I think there would be much lesser risk to malaria. And early diagnosis, of course, reduces a lot of complications and the risk of death, especially in case of Plasmodium falciparum cases.
Okay, sir. Uh, Again, Dr. Sarkar, like you just mentioned about the 2030 target of malaria, I would like to quickly go to Professor A.P. Dash on the same thing. Is 2030 target, which is of eliminating malaria, quite unrealistic because China took over 70 years to eliminate malaria. And in terms of the population size, India is more than that of China. So don't you think that it's a bit unrealistic?
Yes, this I have partly answered when I was speaking. That we know how
Yes.
malaria is caused, we know how malaria is transmitted, we know how a malaria case can be treated, we know how the virus cases can also be handled. So we need cooperation from all the sectors for elimination point of view. As again I said that in the Indian scenario, for elimination, Vivax is going to create a problem. We have to address Vivax biology and its control to achieve elimination. So in science, nothing is impossible. I am still hopeful that malaria will be able to reach the target by 2030, like many other countries.
Okay, sir.
Imagine, if I may add, since
Yes, sir.
I've been to China 12 times. You
Yes,
see,
sir.
this is a mango season. You can't compare mangoes with oranges. The system in China is very different than that's in India. I was a team leader way back in 1993, where I led the team for elimination of iodine deficiency disorders in China. They eliminated in 5 years because of the system they have. So one has to take into consideration what kind of system we have in terms of governance in China and in India. So that must be taken into consideration. That's why political science becomes a very important issue to understand it. जो चीज चाइना में होती है हिंदुस्तान में in terms of implementation is very difficult. Then you have no other choice but to obey. Either fall in line or you're off the line.
I
Absolutely,
would
sir.
I would bolster this argument of sir with just an analogy of maths exam. You know, you have two kids. One is getting 60 marks, another is getting 70, or maybe has reached 90, and you want both of them to score 100. It doesn't make sense that both of them will require same effort, or both of them will have the same starting point, or even both of them will reach the ultimate result in the same time. It's the exact same scenario for different countries. Different countries are in different situations. Their ecosystems, governance, politics, social capitals, and the overall resources they have, everything is different. So it's not rational to compare different countries, but I would say that India's progress is on track. We definitely have major threats or challenges in terms of how malaria can surge back, as we have seen in 1960s. Climate change is a critical concern. It is increasing the risk in multiple areas. But with that, if again implementation is, if there is fidelity in implementation, if your monitoring is good, training is good, and if there is a proper public-private cooperation and pupils' participation, it is possible. it is not absolutely, it is not
Oh,
impossible.
that's it.
We should focus on this.
In
Okay.
statistical language, it's called the S-shaped curve. S. The last mile is always very difficult and very challenging. Initially, there's a delayed starting, then suddenly there's a sharp rise. The last mile is always difficult and challenging to address.
Right, sir. And another question that we have is for Dr. A.P. Dash. Sir, since you are from Bhubaneswar, can the successful programs of eliminating malaria, like Daman in Odisha and MEDP in Madhya Pradesh, be followed in other parts of the country? And will these other states also follow the trail of the same?
Yes, yes, definitely. That is why I cited these two examples: the Mandal project in Madhya Pradesh and the Daman project in Orissa, which has demonstrated that malaria can be eliminated by using the existing strategies. We do not need a new strategy. What we need, new diagnostics and maybe new drug, new modern and innovative drugs to handle malaria. But otherwise, the strategies like treatment, vector control, and diagnostics, these are necessary. And we this strategy, malaria can be eliminated and malaria can reach the zero level in any place. These issues, these things like in Mandala project and in Daman project can be replicated everywhere. But it doesn't mean that we do not need new diagnostics and new drugs. These new diagnostics and new innovative drugs or anti-hypnozoids and whatever you have said about malaria drug, these are required to intensify the elimination. And so I am hopeful that we will reach the target if there is a collaboration from all these sectors. And as you know, the malaria elimination program was affected during the COVID time for 2 years. In some countries, malaria cases increased, not in India. In some countries, malaria cases increased because of COVID-19 and people did not pay any attention to malaria elimination. These are the setbacks in the malaria elimination program in certain countries during the last 2 years. Otherwise, I think I'm hopeful that with support from all the sectors and good funding, with good diagnostics and good drugs, we can achieve the goal of malaria elimination by 2030.
Okay.
Himanshu,
Another question.
if I
Yes,
may
sir.
add from my side, that
Yes, sir.
invest and innovate in implementation. Dr.
Hmm.
Das said a very important thing. The film that is made in Oriya, I think should be subtitled. One picture is better than thousand words. I think there should be a subtitling of this film and widely circulated as an important message to the people.
Right, sir. Let me just mention about the WHO theme, which is which is about implementation this year. So going back to Dr. Sarkar on that, you just mentioned about the use of the technology in elimination of malaria. What are the other technological advancement that we can expect so that malaria can be effectively controlled and eliminated?
So, first of all, we are living a digital age. In fact, I say we are just embarking on a journey of digital age uh, in today's scenario, and we don't know where it takes us to, but it definitely takes us to a faster, more efficient, more convenient world where programming would be much more data driven, decision making would be much more evidence based. So from that perspective, digital technologies in decision making, in planning, prediction, and response is critical. And I believe the Indian government is actually moving towards that direction of result based. So they not only of result based governance, but also as you see in all the different forums, including the likes of G20, India is highlighting the digital health architecture and the innovations there. And so I do believe that there is a huge potential of using digital tools and technologies, especially for the purpose of decision making and surveillance and reporting mechanisms. The next big piece is connectivity. India has recently acquired this 5G network, and mobile network is immensely important in terms of monitoring. In fact, I was going through these reports. The Indian government is right now trying to connect the different Anganwadi centers, making them geotagged. This is really critical when you have at the front line geotag health and nutrition facilities, which gives you a precise location of the health problems that exist in different communities, which helps in better monitoring and targeted intervention planning, which is really critical, and also improved monitoring. The third piece is enablers for the sandbag intervention. So as we talk about, improved diagnostics like ultrasensitive diagnostics, as we talk about better drugs and also vaccines, these sandbag interventions, they can be considered as technologies, but these technologies can also be helped with certain innovative strategies. That what would be the delivery mechanisms? What can be the drug dispensing mechanisms? So these technologies can be tested and tried. Globally, a very big issue is counterfeit anti-malarials. And the blockchain technology in itself is proving to be a game changer in managing these types of fraudulence and mischievous acts, and as well as counterfeit technologies. India is the pharmacy of the world. It is not only having a lot of manufacturing of anti-malarial drugs, it also exports a lot of anti-malarial drugs. So it is critical that we maintain our reputation as a high quality drug exporter to the globe. At the same time, we produce high quality drug. And one last thing I would say is pharmacovigilance. Pharmacovigilance, especially for Vivax malaria, is really critical because some of the anti-malarial drugs, the anti-relapse medicines, they can cause hemolysis, and people are afraid of that. But those proportion who are at risk of that hemolysis is very small. So you need to have that kind of vigilance, and also there are simple card tests available these days to have these risks measured. So these types of tools can help. On the mosquito side, drone technologies, newer insecticides, they can be more helpful, and these tools are being tested and tried. There are several digital mobile apps also that exist for better community action for health. There are apps for frontline health worker monitoring, malaria surveillance and reporting. So these apps can also be game changing. So I believe there is a plethora, an entire spectrum. It depends on what would be the appetite for the countries, what their countries would need, and what would best suit the countries depending on the availability of resources and the overall innovation buying focus and the capacities for those countries. But technology definitely have a profound role in this fight, and we can actually accelerate the fight against malaria using technologies. Thank you.
Okay, sir. Moving on to Dr. Chandrakant. Sir, there is issue of drug resistance, and same is the issue with the malaria also. So is there something that we can do to overcome the issue of malaria drug resistance?
Actually, Dr. Kaushik Sarkar has already answered my question about drug resistance and malaria issue. This is related to the quality of product you are making, and you have to have a strong system of monitoring the quality of drugs that are being produced. It brings a very bad reputation and name to the India's country. As I said, India is the leading nation in the world where a lot of pharmaceutical products are being made. So we have to pick, I think every backyard has a pharmaceutical factory. So there has to be a strong monitoring in terms of the quality of the drugs that are being produced. That will take care of the resistance to malaria. This again, we come back to the same question of implementation. While we know the answers, we know the questions. The question is how to implement them, and that's a challenge. And this debates like this will bring us closer to the reality of trying. I give an example of a crossword puzzle. As we move, we don't have a complete answer, but as we move on with time and have more engaging sessions like this, which Tech Science has initiated, I think more such sessions should be initiated so that we move towards the learning from each other. The second point I want to make is right now, three of us are technical people. I would strongly suggest to Tech Science that also have people's representative participate in this. I would very much like to have Asha, NM worker in this discussion, and also people's representative. So it becomes a Jan Adalat. So we should move from technical discussion to more of people's participation. That would be my very strong suggestion. Thank you.
Surely, sir, we have taken your feedback and we'll try to work on the same things. But like you just mentioned about the drug resistance, so are there particular malarial species which are resistant to the currently available anti-malaria drug treatment?
Dr. Kaushik Sarkar is a better person to answer this question.
So basically, Himanshu, as I said, we still follow the 2014 drug policy. There are research reports of metabolic resistance or presence of genes that causes drug resistance or resistance to antimalarial drugs. That does not mean that there would be a clinical failure if you apply the drug to a patient, which is a complex technical dialogue which needs to be in a forum of technical expert group. But I believe right now the drugs that are being used in the country are capable enough to address any malaria infection, be it Plasmodium or Vivax, depending on how the compliance is. So compliance is definitely a much more critical issue compared to drug resistance. And also we need to ensure that better drug quality is there not only in the country but also in the entire region and globe, because we have from the industry side, India takes a leadership in antimalarial drugs. Apart from that, it is critical that we monitor these genes that exist, which I believe different ICMR bodies are already doing. These institutions are conducting several and intensive research in the genes that are causing different types, the presence of those genes causing different types of mutations. I believe those research will give us a good amount of time even before a widespread resistance can set in, if ever that happens, if ever we face such scenario. So these ongoing research will actually prevent us from getting into that catastrophe. So I believe we are in a very right kind of programming. It's only that we follow the right treatment protocols. Even in the private sector, I think the private sector health providers should follow these policies and the guidelines that have been laid out by the Indian government. There should be proper treatment compliance and a pharmacovigilance, and that's it. That is what is required to solve malaria. It's a simple disease. It just needs proper implementation, fidelity, and compliance from every party.
Okay, sir. Like you just mentioned about the treatment regime and the ongoing program. So I have one question close to that. PCR tests are generally preferred and are considered as more accurate when compared with RDTs. But still, RDTs are used for the diagnosis. Why, sir?
You cannot take PCR to the last mile, so that's the major challenge. So I think both Dr. Pandav and Dr. Das were talking about affordability, and I think this year you would see in the G20 India's health agenda, affordability is a critical element. In fact, sir was actually talking about the pricing of drugs. Diagnostic pricing is also a factor. So see, we have to understand the practical advantages of a rapid diagnostic test. First of all, it's a point of care test. Asha can do that test at the last mile. She doesn't need a blood slide examination. It does not need to do a slide test. It does not need to be transported to a health facility. It does not require expert knowledge to read that test. So it can be done at the front line. So that's why rapid diagnostic tests are done, even with the understanding that there can be certain issues related to Plasmodium vivax and even Plasmodium falciparum. Quality of rapid diagnostic test These are qualitative tests. What about the quantification or quantifiable test? What about microscopy gold standard? So if I have to say anything in addition to RDT, I would suggest that continuous strengthening of the malaria microscopy, that would be a given factor. At the same time, if there is a low cost PCR technology that can be developed, nested PCR tools are being researched right now. If TrueNAT or nested PCR tools can be developed, which are really low cost and taken to the last mile, which can detect malaria reliably, that becomes a point of care test. I definitely believe that that would be a game changer in this battle against malaria, not only in India but also globally. But for now, I think microscopy and RDT are the tools that we have in terms of diagnostics to fight the game. But of course, in private health sector, where you have sophisticated facilities and a lot of resources, people who are seeking care, they are affluent. They can definitely, take the advantage of those better tools and technologies. But as I said, it requires a brick and mortar setup. It cannot be taken to last mile. So you have to think of those challenges and act accordingly.
Okay, sir. That's all question we have for you, sir. And Dr. Chandkan, do you have any final remarks?
I think it has been beautifully sung by Dr. Dash and Dr. Sarkar. Ultimately, the challenge is, as I mentioned in today's theme, uh, innovate, invest into implementation. That's the whole story, implementation. Thank you.
Okay, sir. Thank you, both of you, sir. Again, I would like to thank our distinguished speakers for sharing their valuable insights and experiences with us. Your contribution have enriched our discussion and inspired us and inspired TechSide to do more. As we conclude this event, let us renew our commitment to the fight against malaria. Let us continue to work together to ensure a malaria-free world for all. Thank you all and have a really nice day. Thank you.